Good afternoon and welcome to the Essential HR Podcast. I'm your host, Brian Gorman, here today with a good friend of mine, Mike Wargo, Chief Operating Officer at the Center for the Hospice. Thank you, Mike, for taking the time to be on the podcast. Looking forward to our conversation. And wanted to get started maybe talking about your background. I know you've been in HR a long time. Maybe for the audience, talk about how you got to be into HR and maybe what led to your role today.
Okay, sure. Be happy to. So going back, shortly after I got out of college, would have been 1982. If you might recall, there was a little recession going on back at that time, 81, 82, and nobody was getting jobs. It was amazing. We go to college for 4 years, and back in those days, the belief was you go to college, you get a job, a good job. Mm-hmm. And that all got dispelled. That was a myth that got dispelled pretty quickly then at that time. So I went in the Air Force, and I somehow got into what we then called personnel work. And I ended up stationed for the bulk of my time at Eielson Air Force Base, Alaska, Fairbanks, Alaska. I was there about 3.5 years. And I was running the classification and training unit and then the performance assessment area. And I ended up getting an opportunity to go work for the Alaska Air National Guard to start up a new unit of the Alaska Air National Guard there at Eielson. And so I went there as a personnel manager, and we started hiring people from all over the country, and I got very immersed in recruiting and in all aspects of human resources. So when I got out, I came back to the area. I started teaching. I taught at Ivy Tech for a couple of semesters, and then ended up at Michiana College as the chairman of the business education programs there. Okay. And taught management courses. And then I realized you're not going to make much money in higher education or in education in general, at least not back at that time. And so I had an opportunity to go work for what was then called Midwest Commerce Bank, and then went through a number of iterations, and it's Chase Bank these days, and Elkhart. And I had a chance to go there and worked in human resources, was human resources officer there, and then ended up at Valley American Bank as the director of training and development, and then moved on from there to Quality Dining, where I was the vice president of human resources back at the time when we were still privately held, which would have been in, 90, 80, I'm losing track of the year, back in the early 90s, let's put it that way. Sure. And was there for about 6 years. We went public during that time, and went from having a couple thousand employees when I started to about 12,000 employees across the country. We were in 40 states. And so I was very involved in a lot of different kinds of human resources aspects that I had not really had much exposure to before. So it was interesting. It was a wild ride, and I enjoyed it. And then I started a company called Career Transitions, and along the way ended up becoming a partner in Electronic Commerce Incorporated, and we had a business called Employee Management Professionals. We had a payroll division. We had human resource information systems. And Brian, you know all about that because you were our guy.
That's where we met. Yeah, that's right. That's right.
So we were very involved in that. And then along the way, I think we all decided to kind of go our separate ways and sold off the payroll division. I ended up going to taking the human resources consulting practice as well as the insurance division, ECI Insurance Services. And I took over those businesses, and others took on other things, and I worked for about 10 years then and on my own, or in business, I should say, as doing a variety of different things, and was involved in real estate development and continued to work in the human resources field. But I sold the businesses to the employees back in 2006, 2007.
Okay.
And I had been involved with Center for Hospice Care for many years, as serving on the personnel committee initially, and then on the board, and was board chair for a couple of years. And then we founded the Hospice Foundation in 2007. And after about a year, the conclusion was reached that we needed somebody on a full-time basis to run the foundation. And so I was asked if I'd be willing to do that. And so that's what I've been doing ever since. Going on 13 years of doing this full-time. Spent about 10 years before that working with the organization, though, from a volunteer standpoint. So yeah, that's kind of how I ended up. That's my journey. And I think that the sum total of all the things that I did over the years helped me to get to the point where I'm at right now and doing what I'm doing.
Sure.
I was involved in real estate development. I was involved in human resources. I was involved in fundraising for various not-for-profits, and have been, I was involved in a lot of different things. Worked in the banking industry, and so a lot of what I've been doing over the last 13 years is working out arrangements to buy property, to build buildings, working with architects and engineers, which I've always loved doing, and working with office interiors and Vista AV integration on some projects. And so I think Rob Myers, who owns Office Interiors, he and I one day figured out, I think we've done like 18 projects together over the last 25 years. We first met when I was in quality dining. So, but anyway, so it's been fun working with a lot of different people in the community in different ways, from different perspectives. And so all the relationships that I built over the years, I've been able to, continue to maintain. And those have been very helpful to me as I've been trying to build the foundation. We went from 0 assets in 2007 to we're almost at $60 million in assets.
Wow.
Now. And built the Elkhart campus initially in 2008. That was one of my first projects. And then raised the money and built our current campus here in Mishawaka, which is along the banks of the St. Joe River. Yeah, and we occupy, we've got about 6 acres here and 11 acres over in Elkhart. So it's been fun doing that and working with the people to get the places built and raising the money and working with people in the community. And I've got a great staff that I work with here. And so it's been really good.
That's awesome. And just a wealth of information and wisdom and really excited to have you on today. And I wanted to talk a little bit about nonprofits and how they're handling the current state with COVID-19 and what's going on in our business world, how it's been kind of turned upside down. But I thought, from a nonprofit standpoint, what are some of the challenges that you are facing given what's going on?
Yeah, we're very fortunate. We've been around for 40 years, caring for patients for 40 years. And their families. And so we're kind of a known commodity. The funding that we receive comes from 3 different sources: Medicare, Medicaid, and private health insurance. And so we have a steady stream of income from those sources. Yet we give away about, last year we gave away $2.6 million in services, and which is where the fundraising aspect comes in. And so we have to raise that money or operate from if you have a positive net gain, if you're running your business well, there's always a positive net gain there that you can put toward that as well. Mm-hmm. So we've been really fortunate that we've been able to continue to operate basically business as usual. It really has not impacted us from that standpoint. What did impact it, what has happened over the last few months since the pandemic started back in, we started having some people work from home back in March. I don't remember the exact date, but I know that anybody who could work from home, we had them working from home. Of course, we're caring for patients and their families. It's had an impact on the way we care for them, the way we deliver the care. Sure. A lot more telehealth, telemedicine. Thank God for Zoom and iPhones and that. We're able to stay in close communication with people. So we've been really fortunate that it hasn't really hit us that badly. Unfortunately, though, I do know of a lot of not-for-profit organizations that are really struggling.
Mm,
Uh, Donations are down. They're not able to necessarily deliver their services to their constituents for a variety of reasons. Of course, people are fearful of people coming into their homes,
sure.
and so it's been a challenge, I think, for a lot of not-for-profits. And I saw some statistics recently that said that if this continues to go into the middle of next year, probably half of the not-for-profits in the country are not going to exist anymore, or they'll exist in a different way. They'll
Right.
find partnerships, and I anticipate that we'll start seeing some mergers of organizations that have similar missions
Mm.
that are complementary missions anyway, so that they can continue to do what they do and hopefully do it even better. So yeah, it's been tough for a lot of organizations.
No, absolutely. And and you mentioned funding resources. How are those being handled? Um, I mean, so from your perspective, um, do you see for you guys an increase in that at all, or more of a decrease, or is it kind of status quo?
From a fundraising
Yeah,
standpoint,
yeah.
yeah, from a fundraising standpoint, I have to knock on wood, we've had a good year.
Mm,
Is it where it was last year? No, but I think we're doing pretty well relative to a lot of my colleagues that are out there that are running other not-for-profit organizations. Um, we have we had a campaign that we wrapped up last year. It was a 5-year, $10 million campaign. We wrapped it up the end of 2019.
hmm.
You know, glad we
Right.
went starting one. And we raised $14 million during that 5-year period. And so we're seeing, we have a lot of pledge payments. People are making all their pledge payments. We haven't had anybody renege on pledges that they've made.
That's
Yeah,
great.
so I think, from that standpoint, it's been fine for us. There are things that we are not doing, unfortunately, that we normally would be. We normally would have a number of different events that have either been canceled or postponed.
Sure.
Our single biggest fundraiser of the year is our Helping Hands Award Dinner.
Yeah.
And, we had been doing that for 35 years, and this is the first year that we're not able to hold that event. So we're carrying it into next year. So we have a 2-year recipient.
Mm.
And Rafat and Zoreen Ansari are
Oh yeah.
our
Hmm.
recipients of our award. They've been great collaborators with us over the years. And Michiana Hematology Oncology has been we've had great synergistic relationship for many years, and they've just been wonderful people in the community. So we're very happy to be able to honor them with the award this year.
Right.
We weren't able to have the event, so
Sure.
they're going to be our first ever 2-year recipients. So we're carrying it over to next year.
Next
And
year. Sure.
somebody who had already made a pledge or had signed on to be one of our sponsors, we said, okay, you get to be our 2-year sponsor. So you get the benefit of, your dollars stretched even further. So we have, but that event actually last year in 2018, I say last year, 2019, we raised over $400,000. So
Wow.
there's $400,000 we didn't raise this year.
Wow. That's
That
fantastic.
we'll be going into next year, and hopefully we'll be able to achieve that once again. But I don't know how long no one knows how long this is all going to last, and we
Right.
just roll the punches and try to make our best judgment call when we get to a point where we have to say go or no go on various things. So we just opened our new Ernestine M. Racklin House, which is our new 12-bed inpatient unit here on our Mishawaka campus, and so that's a real positive.
Wow. That's great.
We have that open, and we'll be working now on. We operate a program called Milton Adult Day Services, and Milton Adult Day is located right now across the street from the South Bend Clinic.
Yeah.
On Colfax. And we're going to be relocating that operation to our Roseland facility. So where we've had a 7-bed inpatient unit and office building for, 25 years, we're going to be essentially gutting it and creating a new Milton Adult Day Services program there. So we're really excited about that. And we'll be starting demolition on the interior of the building here next month, starting construction in December.
Wow.
And so that's another big fundraising initiative we have in front of us during the upcoming year, and a challenge for us. But it's all good.
No, you're absolutely right. And you mentioned the events, and that's so true, because you're right. There's so many events that we used to go to, dinners we could go to, and they just have shut down completely, right? So there's just that fundraising opportunity isn't really there. But what have you seen maybe in your nonprofit circles? What have you seen maybe nonprofits do from a fundraising standpoint that has been maybe kind of unique or different given circumstances that we're all in today?
I know a lot of organizations have been doing virtual fundraising events.
Okay.
And silent auctions, and they've been doing the online auction type approach. And then having an event, for instance, St. Joseph Health System has had a event for years called the Secret Sisters luncheon, and they had it yesterday, but it was virtual, and I think there were only like 15 people that were able to actually be there, that were putting, that spoke and did various things. So it was kind of like doing it in like the real event, but and people would call in or dial in, or they would be able to see it online. And I think they raised, I don't know how much they raised, but I think they still raised money from the community for that event. It's been suggested to us that we do something similar. We may do something with maybe our athletic type events. We've had a walk for hospice for 30 right. years. We had Bite Michiana for hospice for 11 years. And this year, of course, we canceled both of those events. And so we're looking at possibly doing something virtual where someone could, walk, run, or ride for us, and
sure,
just from friends, just like they normally would. And but they can do it at their own pace and by a certain time. And here's a route, and come up with ideas. So we're working on some concepts. Don't know that it'll go anywhere, but that is something we're working on right now. We are having a couple of events that are non-fundraising events. They're more stewardship events that we've held in the past in person. We're going to be doing those virtually this year. We have a Gardens of Remembrance and Renewal at our Elkhart campus. And every year people donate bricks and benches and trees in memory of their loved ones. And so rather than have an in-person event, we're going to do that virtually.
Oh, cool.
Same thing with our Veterans Memorial here on our Mishawaka campus. Every year we have a speaker, and we usually get somewhere between 80 and 120 people for that event. We've had more than that at various times in the past, but we're going to do that virtually as well. So it's like being there, but not really being there.
Sure. No, absolutely.
And I don't know how that would work long term. I personally wouldn't want to do it that way long term, because I like the personal interaction with people. Right. I think a lot gets missed because you're not around others, and you don't have that the excitement that you can have when you're around others that are excited. And I think that's one of the things that I think's been difficult through this pandemic, is people haven't been able to get together. Right. And as you mentioned, Brian, there's lots of events in the community, and we've always been supporters of many organizations that extend our mission to improve the quality of living. And we're usually at least 15 or 20 events each year. Nothing, Right. Nobody's doing anything. So, and you see a lot of the same people at a lot of those events.
You do, yeah.
Yeah. So there's a lot of people you saw fairly regularly that you're not seeing at all right now.
Right.
And unless you have a reason to call them, or you get to talk to them, but you know, how often do you have a Zoom conversation with someone just to have a call, just to have a conversation?
Right, right.
You know, I miss that. I know that it was a challenge for us. We were out for 9 weeks at the beginning of all of this. And after 9 weeks, we said, okay, I think we can come back to the office. We developed the protocols necessary to make sure that we were able to social distance, you know, the masks and gaiters and various things
Yep.
that people wear. So we have all those protocols built in. And being a healthcare organization, it's kind of natural. People wear masks anyway, oftentimes. But a lot of the administrative type folks don't. And
Sure.
so it's a learning curve for many of us, a reminder of what we should be doing. And so, but the isolation, I think, that people had during that 9 weeks it took a toll on some people, I think.
Right.
And I made it a habit, you know, and I think just from a human resources standpoint, I think it's a good habit to try to dialogue with people, even though you can't, you know, be in a room together, to
Sure.
figure out ways to do that. And I love the Zoom platform for those purposes.
Right.
So during that time, for that 9 weeks, we literally every single workday, Monday through Friday at 10 a.m., we had a call together. And so we were all on the call. We were all, you know, it was tried to make it fun. People would have different backgrounds. You know, this is my office background. I mean, I'm in my office right now, but
Right.
you know, you're somewhere else, and you know, there's a blank wall behind you, or you or maybe there's your laundry's hanging back here or something. You know,
Right.
all of you don't see it. So people started using those virtual screens.
Yep.
Backgrounds. And so it became kind of a game with some people to say, hey, I'm going to come up with a different one every day. And I'm even going to dress the part. So
That's cool.
yeah, it was
Great,
kind of
a great idea. Yeah.
people doing that. And we just touch base. We talk about what we've got going on. I think from a productivity standpoint, people were just as productive as they would be if they were in the office, because we really set people up with the technology. Everybody had a laptop computer.
Mm-hmm.
Everybody had the same type of equipment.
Yeah.
All of our files, we were fortunate that we had moved to a cloud-based file storage system for all of our foundation materials. So we had all of the information was readily accessible as long as you had a good internet connection.
Sure.
You could any file you needed, and most of us took what we needed from our office, actual physical files, so that we were able to continue to operate, you know, efficiently. So I don't think we missed a beat from that standpoint. But what we did miss is that personal interaction.
Sure.
And but I think it's going to change the way that businesses operate in the future.
Right.
I really think that's going to happen.
Well, I was going to ask you, maybe to finish up, you know, what trends in HR do you think are going to come out of this? And given what you've, in all of your experience and what you've seen and maybe know HR to be, you know, what do you think is going to happen? And what do you see, you know, fast forward a year from now, what does look different from an HR standpoint? What are HR managers doing that they didn't do a year or two ago that they might be doing now? So what do you see happening?
Well, you know, I think that the days of everyone working from an office are probably gone. That everybody comes to the office and you just have a place that you can sit, and you come in 8 o'clock on Monday morning and you're there, and you leave at 5 o'clock and you're off you go. The world just doesn't work that way anymore. I think in general, we've learned that over the years. But the 8 to 5, Monday through Friday, I think is probably is gone, which I think is a good thing,
right?
Personally, because I think that some people are not as productive at certain times of the day as others might be. Some people are morning people, some people are night people, and
Sure.
as long as people are being productive and accomplishing their goals, and that's what incumbent upon the managers to really establish verifiable goals that you can help your staff achieve. And then you can measure their performance based upon the outcome. And that, I think we're we're realizing that more and more now because we don't see people all the time. I mean,
Right.
they're not physically present oftentimes. But I think a lot of positions, a lot of sales positions, for example, the people you want out being out and not sitting in the office.
Right.
It's like, okay, you're not going to have a place to come. You can come in for a meeting, but other than that, we want you out, seeing people, and that might, you're calling on clients, you're calling on prospects, and I think that's, and I've got a friend of mine who owns an insurance business, and it's like, I don't need to be in my office. I have all my files are, accessible to me through all of my different carriers. Everything's online.
Right.
I mean, literally, you're on the computer all day anyway in the office. And if you need to talk to somebody, you just do this.
Right.
I think that Microsoft Teams and a lot of the other products that are coming out now, if we learn how to use them effectively, I think it will increase productivity, and at the same time will be beneficial because we won't have to have big office buildings anymore. We can operate a smaller office building. Now, I have friends of mine in that line of work who probably don't like that idea.
Sure.
But the reality of it is, I think, people are able to work from home. People are able to work, and they're proven through this process, through this time over the last few months. My son works for Sony down in Nashville. He works for the music publishing division. He hasn't been in the office since March.
Wow.
And he's been told he's not coming back till after the first of the year. And his entire group works from home. I don't think they missed a beat.
Right.
And
Right.
but he said, I think I'm more productive from here because I'm not, I don't have to be in there at a certain time and fight the Nashville traffic.
Right. Sure.
Because the commute itself, he said, I lost 2 hours a day just in driving back and forth.
Sure.
So, from that standpoint, that's improved productivity. As long as you feel like you can trust people to do what needs to be done, I think that's going to be the wave of the future, at least in the service industries. Now, the restaurant industry, gosh, I hope for the sake of the restaurant industry that we get something going here before long, that people are able to go back and they can be at 100% occupancy again, or
right.
Because right now I don't know how a lot of these restaurants are staying open.
Sure. No, absolutely.
Yeah,
absolutely.
I know so many have closed.
Sure. Yeah. No, absolutely. Well, thank you so much for your time today. It's been a pleasure talking to you, and known you for a long time, and was really excited to have you on the show, and wish you nothing but the best moving forward. So thank you so much, Mike. Appreciate it.
Thank you. I really appreciate the opportunity.
Thank you.
Take care.
All right. You too.